something called as the cleft lip and cleft palate. In an MBBS examination, particularly in practical examination, this is an important short note. This is a very common case that you can get in your final MBBS. And what are the things that you are required to know as in a treatment of these ones? A cleft lip and a cleft palate. Now, what are the important surgical issues also to consider in this part? Now, the minute we talk about a cleft lip and a cleft palate, there are multiple questions that we start in embryology to discuss about in this one. Now, talking like as a picture like this one, the first part in the embryology is, yeah, this. Now, the first part that we talk in the embryology is how does the palate develop in the face. Now, what is important is that as you can see, there are two processes, something called as the frontonasal process, and remember that there is something called as the frontonasal process. So there is the first thing that comes out is something called as frontonasal process. Now, the frontonasal process will now give rise to the median nasal and the lateral nasal process. So, the frontonasal process technically will give rise to the median nasal and the lateral nasal process. Now, when we talk about medial nasal and the lateral nasal process. Now, the minute we talk about these ones as the median nasal and the lateral nasal process, okay, what you are required to know for an important thing is that this medial nasal and the lateral nasal process has everything to do with this one. Now, this medial nasal processes, remember, is going to give rise to the two globular processes and the premaxilla. So there is a premaxilla and then there is a globular process. The lateral nasal processes, remember that the lateral nasal processes will in time fuse with them. Now, what is important is that the mandibular process, now in this similar story, there is something also called as a mandibular process, and this mandibular process, remember, this mandibular process will technically give rise to a now a maxillary process which will give rise to the formation of a palate. So this is a bit complicated one and you are not required to know about this one. Now, there are many other difficult things in embryology. What we are not required to know, but what we are required to know is something in which we talk about, sorry, on this one, yes, something in which in the cleft lip and in the cleft palate, let us talk about the lip and the palate. How does it develop? Now, what is important, as I've said, is that when you talk about a growing embryo, what is important is something, as I've said, the maxillary processes and the two lateral. So this is the frontonasal process. This is something called as the median nasal process, and this is something called as the lateral nasal process. So let me use various colors for them so that you can understand them very simply. Now this one, so what will this process be called as? That is not in the midline. Is called as a lateral nasal process. So this process is called as technically the lateral nasal process. Okay. Now, what is important is we also have another issue in which we have something called as a maxillary process. Okay. So what are these things, guys? This thing is something called as the maxillary process. Now, if this is the maxillary process, please remember if this is the maxillary process along with these two, then you have now a median nasal process, as you can see very well in this one. I marked it with red. Now guys, tell me, what is the basic problem if these things don't fuse? Very simple. What is important is, now let us consider a theoretical scenario in which this blue, that means the maxillary process, and the yellow lateral process does not fuse. So the first problem is that this patient will be born, well, probably with a deformed nose, but what is going to happen is that he's going to have a big congenital cleft in his face. And remember that this cleft will occur because cleft will occur because that this maxillary process and the lateral nasal process. So the maxillary process, please remember that, will now fail to fuse with the lateral nasal process. This problem is called as a facial cleft. Okay, that's it. Now, what is important is that now the next part of the story. The next side of the story is something in which now talk about the embryology. When you talk about the embryology, then please look into that the median nasal process and the maxillary process give the lateral part of the upper lip. So the second part of the development is that the median nasal process, okay, something that jutted out in the midline. Okay. Now, so in the medial nasal process, please remember that in the medial nasal process plus the maxillary process. So the medial nasal process plus the maxillary process will give rise to the lateral part of the upper lip. So please remember that the medial nasal process in this picture can now fuse with the maxillary processes and forms the lateral border of the upper tip. So that means if I draw a picture, these are the lateral processes, okay, and this one is the lateral nasal process, and this one is the medial nasal process. So what is important is that these processes or the maxillary processes, which I have shaded as blue, okay, so these maxillary processes, remember so these are the two. Now, so remember that these ones needs to be, so that means a median nasal process with the maxillary process. That means if you see this diagram, guys, yeah, this one. The median nasal process is this always, and the last one is that. So the median nasal process is exactly like that. Now, what happens when you have a lateral cleft lip? Remember that a lateral cleft lip will technically mean a lateral cleft lip, a lateral cleft lip. Remember that a lateral cleft lip will thus have the origin from the median nasal process and the maxillary process. Okay, the median nasal process and the axillary process is the next one. Okay, the third one is that the third one is that the in the lip that you see, okay, this part of the lip is called as a philtrum. Now, what is important in the philtrum is, now what is important is in the philtrum is that the development of the face, basically the two globular processes. So that technically, please remember, the word philtrum is derived from globular process. Okay. Now, so these are all the things. Now that means when there is a gap, it will lead rise to a central cleft lip. Okay. Now the final two parts. The final two part means that so these are all the things that we have discussed. Now let us talk about the final part of these features. How does a hard palate form? As I've said, hard palate will be by something called as a premaxilla plus. Now, so that means what is important in this one again is, please understand, premaxilla is the most important thing, along with both palatal processes is equal to the hard palate. So please remember that. So these are all the things. Now, if you have, so that means I will again repeat what you said. So please remember premaxilla along with both the palatal processes, their union will make it like this. So that is called as a defect in the cleft palate. Okay, that's it. So that is the first part of the story. Now the second part of the story is now the second part of the story is now what is the clinical feature and what are the important things that I should note about in the classification. Now, if someone asks you guys, can you classify a cleft lip and a cleft palate? Now, when you talk about classification of a cleft lip and a cleft palate, it is better understood by this way. When someone asks you in an exam, classify a lip or classify a left palate, it could be category 1, something called as a cleft palate. No, cleft palate. Okay, so the first one is a cleft palate. Sorry, sorry. The first one is technically something called as a cleft lip. So if I ask you the classification between them, the first one is something called as a cleft lip. Now the cleft lip could be technically alone. So that means what are the variants that you have? You have an unilateral cleft lip, you have a bilateral cleft lip, and you have a medial or a median cleft lip. Now next one is something called as a cleft lip, the cleft of the primary. Now, a Now that means a cleft lip is done. So now what we are doing is that we will go to cleft palate only. Now when you talk about a cleft palate only, that means it can be a complete cleft palate. That means both the hard and the soft palate are done. So that is called as a complete. Okay, and then if that is a complete one, the rest of the things, so please remember, are incomplete. Now, so I'll again repeat. Cleft lip is unilateral, bilateral. So cleft palate, however, it depends upon the amount of completeness of the evidence. Okay. Now, the next one is so the next one of concern is you have a cleft lip alone, you have a cleft palate, and the third one are combinations. Do this. Okay. So these are the important things that you are required to know in this one. Now, what is important in this one is that what are the complications that arise due to a cleft lip and a cleft palate. The complication is only one, that means feeding the baby is what is important and what is the most difficult thing for everyone. Okay, so please remember that we have talked about a cleft lip, we have talked about a cleft palate. Okay, now so please remember that that is what is the important part of this one. Now let us talk about the treatment of a lip and a palate. Now, the treatment of lip and palate, please remember the treatment of the lip and the palate. To begin with, let us talk about the treatment of unilateral cleft lip. Can you give me an example of such a cute baby? Yes. If you see this, wow, not this one. So let us talk about unilateral cleft lip. Now, if it is an unilateral cleft lip, okay, so please remember it is an unilateral cleft lip that we are talking. And in this unilateral cleft lip, what are the surgical options that we have for this kid? So let us write them. So for an unilateral cleft lip, the most common one is something called as Millard's rotation. So a very common one is asked in the Viva. Okay. So this is something called as a Millard's rotation. And for this Millard's, we have something called as the Millard's rule of 10. वो क्या होता है? 10 weeks must be the age of the bacha. 10 pounds is the weight, and 10 gram hemoglobin is something that you require. So I have remember that. So it could be at 10 weeks, it could be 10 weeks, and then after that, I will target. So that is the first thing called as the Roulard's rule of 10 into this. So this is what you are required to remember. Now, for a cleft lip, there are other arrangements. Now, for the cleft lip, please remember there are other. So that means there is something called as a Millard's cleft lip operation. Okay, and now so that is all about. So that means now when you talk about this one, in so that means what is the important thing? Just give me a second. Yeah. Now, so that means that this uh, Millard's cleft lip has another competitor called as a Tennyson Z plastic. So these are the basically the surgical procedures that are done. Nothing that great to be spoken about. Now the last question is when should we go for a surgery? The ideal age is approximately 6 months, not weeks, not years. So please remember that by 6 months you should do that. So more or less we have talked about a cleft lip and I've told you about something called as a Millard's rotation and then the Millard's now. So with this then so you have the Millard's and rotation. Okay, that is done. So and this is the management of an unilateral cleft lip. Now when you talk about is in bilateral cleft lip. Okay. Now, in a bilateral cleft lip, what is important is you will use something. So now you will use a technique. If that was Millard, this is called as Mullikan's operation. So what is the Mullikan's operation? This Mullikan's operation thus is bilateral cleft lip. And please remember that in this technique, the child should be operated. The procedure is little big. And remember that those 10, 10, 10, that logic more or less does stick on. Now, so this is all about things that you are required to remember. So I've told you about a cleft lip, I've told you about a cleft palate. Now let us talk about a cleft palate management. Now the problem in a cleft palate is that there are multiple nasal mucosas, the pain sensitive mucosa. So that is only the thing that I am trying to do. Now, uh, what is important is so this is something. Okay. Now, what is this one? Is in the hard palate. Now, basically, the idea is that in the hard palate, uh, so now and they have written some big things. So in the cleft palate, then uh, in the cleft palate, the number of deaths. Okay, in the cleft palate, Okay, now see this one. So in a in a cleft palate, remember that. So have you remembered the technique? There is something called as the Wardell's technique. And in this Wardell's technique, what is done is that means that if this is the palate, you need to make an incision by the two sides, and then you need to stitch these things off so that it makes up to the complete line. So this operation is called as a Wardell's operation. There are many other techniques that you are required to know, but this is what you are required to know maximum about this. So what is important in this cleft lip and this one is something as I've said. Now again the same thing like a is again the rule of 10 for a cleft palate. Now when you talk about the rule of 10, okay, again the same thing does act. It is 10 kg weight, 10 kgs of age and 10 gram percentage of hemoglobin. Okay, so this is all things about something called as a cleft palate. And so please remember that. So that is something called as a Wardell's technique. So more or less I've told you about all. Now what are the complications that arise due to a cleft lip and a palate? Now when you talk about complications about a lip and a palate, okay. Now number one is that feeding difficulty. Okay. Number two is that difficulty in breathing. Okay. Next, so how is it being felt like? So that means the complications are these two. So please remember this one. So the complications of these now repair or not in repair of a cleft tool is feeding problem. That means whatever you feed the orbicular receptacle cannot work, and then you have a breathing problems. So more or less, I have given you a very quick summary of a very complicated chapter. Like this one will be called as an unilateral incomplete cleft lip. Why incomplete? As you can see, the nasal bridge is there. Whereas see this one, this is a bilateral cleft lip. Okay, so this is things that you are required to remember. Now, as you can see this picture, beautiful picture, this is something called as a cleft palate only, that most of them are required. Before I end the day, there is a new system given by Bailey Love around a long time back, and there is something called as a Lahasal system. Now, in this Lahasal system, what is important in this Lahasal system is this Lahasal system was given by a man called Ocreans, and then he was the monumental planning heading this as an idea. Now, what is important is, now what is complete, what is incomplete? Okay, no. Now, when you talk about the Lahasal system, the L of the Lahasal, please remember the L of the Lahasal is the lip. Now, when you talk about the lips, okay, then the next ones are A, that means the alveolus, okay, and so please remember this one. So there is a lip, okay, then there is an alveolus on both the sides, and that's it. So these are the things that you are required to remember, and then there is something called the H palate and the lip. Okay, so these are all the systems. Most of it is not used nowadays. This is more or less theoretical things of some sort. So we have talked about a cleft lip. I've told you about a cleft palate. What is the Millard's rule? What are the complications of this? So with this, what we'll do is that we'll stop this one. Thank you everyone for the class. You can stop the recording now.